Hello, it's Alexa here, and just look what company I'm in. I'm with physical therapist Walt Fritz. Thank you for joining me, Walt. How are things with you?
Things are going great, Alexa. Thanks for having me here on your podcast.
Yeah, no, it's a treat. And this is an extension, really, of episode 74 of the Singing Teachers Talk podcast, where you shared your expertise in your physical therapy background. And we're going to go through a little bit of the self-guided kind of interactive element now. So, first of all, can you just tell us what we might want to be mindful of? You mentioned in the podcast there about how if we do it on ourselves, it might feel a bit different to if you were doing it on us.
Historically, my patients have often said to me, let me back up. I always teach self-work, and my self-work comes from, it could be exercise as a physical therapist, but it's also the manual therapy, the slow, prolonged, relatively gentle type of stretching. My old brain said, oh, we're stretching your tight connective tissue. My new brain says, we're stretching something that's going to your brain and saying, aha, that feels useful. All right. What was your question again? I'm sorry.
No, it's
Your
okay.
question, yeah.
What might we want to consider when we're doing this on
Oh,
ourselves?
the difference between self-touch versus social touch. Yeah, we talked about that briefly on the podcast, where you may not feel the same thing as when I do it with you. And I saw that historically in my patients, where they'd come back and say, you know, Walt, I did the stretches, but it didn't quite feel the same as when you did it. And for years, I thought they were just lazy and they really didn't want to do it. They didn't do it, so they blamed, oh, it wasn't the same. And while that could be true, there's a couple of papers out there that show to me that there are reasons from a neurologic and behavioral-based perspective why my touch on your face might feel quite different to you than when you touch yourself and stretch yourself, okay? So we have to accept that as a given. It may not be quite the same. Some might say it may not be quite as good, but can we determine a way where, even if it's not as good as what we did in session, is there a way that you can carry this over on your own to possibly maintain your level, but ideally to continue to build, continue to improve, and then make you not need me? That's really my goal. So that's what my goal is with touch. And here's part of the problem, not a problem, but the challenge as a manual therapist who uses a shared decision-making model, and one which is based in a reference where you need to feel the input. Can we do something, Alexa, for your issues, which you feel, oh my goodness, that's that feeling I get. I'm going to make something up. At the end of a performance, when my tongue gets really tense or fatigued or it cramps or there's pain, can we get to that point where you say, yeah, whatever you're doing right now, that's exactly that feeling? And can we not only give you that replication, but can we do it in a way that feels potentially helpful and not just that I'm taking you to that place of discomfort, right? That's a real challenge.
Yeah, sure. So where would you like to start?
Well, just before we start, let's be full disclosure here. Before we started this, you not only shared that you had some issues that you don't, and also that you didn't mind sharing them with the world on social media, et cetera. So, Mike, okay, we're gonna do a role playing here. You're coming in to see me for some help with your issue. Hi, Alexa. What brought you in here today?
Hi, Walt. Well, when I sing, particularly in my upper range, I tend to feel a tension in my jaw and like a tugging feeling in my tongue.
Got it. So when you go to your upper range, you feel a tugging feeling in your tongue and a tension in your jaw. At rest right now, or as we've been talking for the last hour on the audio podcast, would you say you can feel any of that?
Yes, in my jaw, I tend to grit down as part of like my concentration face. Um,
Yeah,
yeah, I tend to feel that quite a bit in the masseter area.
got it. So again, as we talked about in the audio podcast, you used a specific muscle, the masseter. And one thing, well, okay, so early on when I said, "Oh no, it's not about your fascia or your muscle; it's your nervous system." There was a time in my career where I said, "Oh no, it's not your masseter. It's the nervous system," which is basically stepping on someone's belief system. I would never do that anymore. But I don't care if it's the masseter. But what you did here was really key to me. Go here for me. And what I want you to do is just poke around in here a little bit. Can you feel what you might feel when you go to the upper range of singing in that way that you say, "Oh yeah, there it is, right there"? Can you feel that? Can you replicate it? Can you connect with that feeling?
Yes. I have to kind of clench a bit.
So do the clench, right? Do the clench.
It makes me look like I'm a bit in pain, but I'm not.
Yeah, yeah. There's a massive amount of self-exploration that I have my patients, my clients do, not just with them touching their self, but then with me either touching them directly or doing hand over hand or whatever. Because what I want to do is I want to connect with your felt sense or part of the felt sense of the problem. And whether it's the jaw issue or the base of tongue tension, whatever that is, it's that upper range feeling, right? And what ends up happening is you come in, I've got a problem in my upper range, and it's, let's just think of it as the center of the bullseye. Are there other rings of that bullseye that we can start to get you connected with? So even at rest right now, you've not sung in the last hour at least while we've been chatting. Can you feel any of that right now in your body, in your awareness, that makes you say, yeah, I can feel it at a lower level right now? Some people, the answer is no. It doesn't happen until I sing for an hour or until I swallow 20 times, whatever that might be, right? What about the tongue feeling? Do you feel any of that now?
Now that I'm bringing awareness to it,
Yeah,
I do notice a slight pressure
yeah.
underneath, like the
And
soft.
is that that upper range feeling?
Yes.
So, by the way, for people who are watching this, what you just did, Alexa, reaching up here, wasn't something I coached. You went there on your own, which is exactly what I want my patient to do, because a lot of patients, they don't point, they don't poke, and I'll say, "Have you ever poked around in there?" And they might say, "Oh no, no, I never do that because someone told me not to." When the secret life of Alexa is, "Oh yeah, I poke there all the time, right? But I don't want to tell anybody because I was told not to poke there." Some people, we never know what people walk into our clinics with, right? So what I love to do is when someone comes in and localizes, and then what I'll do is I'll reach in. Now I'm going to reach through the screen right now, and I'm going to take my hands with you, and you'll say, "You mean right in here?" And then you might say, "Yeah, that's it." Or you might redirect and it's like, "No, it's down a little lower. You got to push harder," or something like that. Because what I want to do is see if the two of us can get into synchrony, right? The concept of synchrony, and whether it's you touching and me touching over you or me doing the touching, I want to do something that you say, "Yeah, that's it right there. That's part of it," or that's the area. That it's a concept from psychology of the concept of synchrony, where we're basically kind of both in the same plane. And some of it is connecting with your past as well as your present through your priors. That's my prior experience that maybe has sort of influence where I am today. Can I touch you in a way that we become synchronous to connect with that sense of priors? And you start to say, "Yeah, right there." That's the magic point in the work that I do, where if the two of us can get sort of in sync, then my touch can be possibly impactful. Is it impactful because I'm releasing that muscle tension? Is it impactful because I'm, stretching your fascia or the muscle? Or is it impactful because we went from peripheral to brain, where you start to say, "Yeah, whatever he's doing right now feels good. It feels like it might be helpful." But
Hmm.
what about in this setting where we're trying to help you help yourself, right? Can you come into this part of your body, to an area, and I'm going to let you decide, where is that? What part of your fingers or your hands do you need to do to start connecting with that upper range type of problem that you described? Go there, push there.
Mhm.
What do you feel right now?
It's nice when I go a little bit harder with my thumb
Yeah. And here's where I like more gentle intervention.
Mm.
As a person, as a human being, I don't like when people are aggressive with me or manipulate aggressively. So it's real easy for me to then carry that over in the way I treat others. But I could be completely missing you as a human being and your individual preferences and values if I try and force gentleness on you here, where you like a more assertive pressure or you like massage. Whereas I'm not a massager, I'm a lingerer. I'll linger at a stretch, and you may want movement. So what I want you to do, is Alexia, is to go to that place with the level of pressure that you feel is most useful.
And if I'm doing this, I won't, would it bring any harm if I went too hard, or would my body just go, hey, that's too hard, stop?
Well, that's where I need to figure out who you are as a human being. Do I trust you? Do I trust you not to hurt yourself? Do I trust you to know that you have sensation here, right?
Mm.
That there's no numbness, there's no other problems in that area, which may cause you to push too hard and maybe injure yourself. Do I trust you as a human being that you won't hurt yourself, right? A lot of people believe that it has to hurt to help. I'm not one of them, but many people are. Okay. In an ideal world, I would never treat somebody by telehealth without having the opportunity to touch them first, to interact with them, not just their tissues, but the whole person, right? So we can establish a relationship. But COVID has changed the rules. Sometimes we are presented with a telehealth situation, and I need to figure out, do I trust you as a human being? Because there's people who come into my room who I can't trust in that way, and I need to back off from my pressures and maybe artificially tell you, no, don't push that hard. You might hurt yourself. Now, if you're working here in the area of the carotid arteries, yeah, you could hurt yourself. You could really hurt yourself. So I'm going to be a lot more parental there, right? And say, no, don't do that. You will hurt yourself. You may hurt yourself, right? Other areas of the body, I feel, are safer, but it still takes some coaching, right? So what the goal would be here is to figure out a level of pressure, a level of input that you feel impactful both right now in the moment, but as well as for your upper range. And in order to do that, I may ask you, Alexa, and again, we didn't chat about this beforehand, and you may not want to do this or feel comfortable, so feel free saying no, but do you mind going to your upper range right now? Do you mind singing to see if you can feel like you're starting to poke at, engage with, intervene on the area of your body that is impacted when you go to your upper range? And it's your choice. If you want to say no, I totally respect that.
I'll go onto a little siren. I'll just step back from my computer. So when I go up there, am I feeling for the sort of pressure I would get, or whether?
Yes. So to some people, they're looking for the crud pocket, the thickness, the grumpiness, the muscle tension. That's certainly part of it. Part of we want to feel it in our fingers, but I want you to feel it up here in your brain to say, yeah, when I do that, I'm bringing that negative feeling more to my awareness, not necessarily making it hurt or not necessarily calming it, a big long continuum, right? But whatever I'm doing feels impactful.
Hmm. Okay.
Does that make sense?
Mm-hmm.
Yeah.
I'll do a little octave thing coming down. Yeah. Oh, interesting. As I went to do it, I felt
Yeah.
something.
Yeah. So there, it's not only having to do it, but it's bringing you into contact with a sense of awareness. It's huge. And you talked about on the audio podcast, your interview with somebody else who talked about awareness. And a lot of the modern approaches are bringing awareness as a key factor, not just the tissues. Now, go ahead. You were about ready to try it, and then I interrupted you. Where is it? Find it, feel it, experience it.
Is on that top note. I feel some form of constriction, but
Mhm.
actually having something there, it wasn't quite as tense as I feel it without having a touch.
Lovely. So what would happen, and you don't necessarily have to do this right now, but what would happen then if you maintain that stretch, that input, that poking, and you went there repeatedly, okay? Or you purposely went through an entire song with that pressure to
Mm,
see if you can then figure out a way around that, right? We're figuring out strategies to move beyond this, and whether it's a behavior-based strategy, a pedagogy that we teach them a way to do it, right? An exercise, a strengthening, or a manual therapy. Can you feel a way where you feel like, okay, I'm impacting it right now every time I go there, but it's less? Can
mm,
you allow your brain to begin to see that you have the potential for change from that, so that you, as you slowly remove pressure and continue that sort of range type of test, can you feel less of it? And
mm,
that's the way we like to do this, is not make you where you can only feel the benefit when you're poking there, but can you then evolve from that and taper away from it? So you say, you know what, whatever we did there, I can sing now with less of that feeling, with less of that negative quality. That's
mm,
true. That's truly the nature of what I do. And whether it's me with hands on with you, or
mm.
you beginning to institute some help with me, then me tapering off for you doing this, can this be impactful in a way that has lasting impact?
Mm. And interestingly enough, when I had that there, I wasn't aware of anything happening in the jaw. I didn't feel
Right.
grippy.
Interesting. So in we are definitely being spontaneous with this interaction, as if it was an actual patient clinician interaction. What happens if we hold that, right? What happens if we go up to the masseters, as you said, and put that input, right? Try it just the masseters now. Go to that spot where you feel like, oh, there it is. And
Mhm.
whether there it is feels like you're provoking it gently or calming it, go there and then try singing again.
Didn't feel anything that I would usually feel.
Yeah. Now, the next person that we did this with could have
Yeah.
the absolute opposite effect. They might have gone here or here and said, yeah, that makes it worse. Or I'm more aware of that. And me sitting here in the middle, I call that a big long range of the continuum of relevance. I don't care whether it brings it to your awareness or calms the sensation. Whatever it is something that up here, as well as here and here, feels impactful. And that's how I would initiate treatment right there, whether it's me working with you or you working with you on your own. Now, invariably, the question is, well, how long should I hold this for? What
Mm,
time of the day should I do this, et cetera, et cetera? All those questions which we as clinicians are supposed to know what to tell people. And I tell people when they're taking my trainings, make something up, because we make this up
mm,
based on our experience or education. But ultimately, we have to make it an N of one. I may think that this is best done before you sing, but you may find that worsens you. So try it after you sing. You may find that doesn't work. So try it when you're not singing at all. Let's work on this together, or make something up because we're expected to say something smart. Okay. Um, and but basically what I want to tell you, Alexa, is you may find it helpful to do it before or
mm,
after, but ultimately I want you to be the decision maker here and not me, which
mhm,
is really hard for a lot of our clients to own that. They want us to tell them what to do. So, you know what? It's a give and take. We make some of it up, but then we translate that into their own experience. Some people want a little bit of input. I might say to you, if you really grab me by the shirt and say, Walt, stop being so vague, tell me what to do. I might say, okay, try this for a minute or two, and then try and go into singing. Does that feel helpful? You may want to do it more frequently during the day or for longer periods of time. You
mm,
may want to play with how much force you're using. Alexa, you like more force than I use, but that doesn't mean your force is wrong. It's what your brain, your past and present experiences find really, really useful. So take
mm,
that level of pressure that you enjoy and see if you can begin to create an impact for that upper range issue.
mm. And I'm not surprised that I like it firmer because I remember even as a kid, if I was holding my mum's hand or my nan's hand, I would do this on their hands to get it tighter. I'd be like, hold my hand tighter, hold my hand tighter. So I can see in different areas of my life, actually, I like touch to be firmer.
Yeah. And in my world, in the manual therapy world, there's all these different models. Some teach that, oh no, real light pressure is not only sufficient, but it's what worked best. And other people who are basically saying, no, you got to get in there and you got to dig it out of there, right? And instead of being a person over here who says you got to dig it out of there, or instead of being the person who says, no, we can only do this much because it's enough, I want to be a clinician who says, let's you and I together figure out what you feel is the correct amount of pressure or the correct amount of input or the location, etc. And it takes a lot of letting go of ego on the part of us as the professional to say, I know a lot, but I don't know what will work for you until we start working on this in a shared decision-making model. Okay.
Mhm. And you
Now,
mentioned
we also, oh, go ahead. Sorry, go ahead.
you just mentioned about you can have this beforehand or after or during or whatever. Can this be part of a preventative tool
Hmm.
as well? Or,
Oh boy, how does one truly prove prevention? It
mm,
takes a really well done study with a huge group of people and a lot of really smart academicians to say, here's how we figure out prevention. Um, but because part of prevention is up here as it is down here.
mm,
You may be a person who feels that in order to be best equipped to prevent that, you need to do it regularly. And not that I want to be a chameleon and play whatever it is that you think is important, but I have to understand that if you feel that prevention is important, so therefore I should do these, then maybe that's exactly what we need to talk about. Maybe you need to include a little bit of this as your warm up in your warm up to for quote unquote prevention. I don't mean to be too slippery with this, but prevention is incredibly difficult to know for certain,
mhm.
although a lot of people act like they know for certain.
Yeah, it's like trying to prove the unprovable. How do you know?
Exactly, exactly. But yet we're expected to know the answers to that. So, I make stuff up, just
Yeah.
like we all do, right? But I make stuff up that this sort of comes from a balance that, yeah, this might be helpful for prevention, but does it feel useful to do this each time? Do you need to do this use each time? And maybe you can find that you can kind of taper over time and still not lose the gains that you feel right now. Why don't you try that on your own? But if you feel that you want to do this every time, every day for prevention, that I would never try and like take unpry your fingers from that belief system.
Mm.
We talked off camera about the potential of doing some tongue work, and you were a good sport and said that you might be willing to do that. Now, I can't grab hold of my tongue because I'm going to lose the ability to speak. And normally, I didn't plan on doing any of this, so I didn't bring along my little tongue model that I actually have. But I do a lot of tongue work. Tongue work is it's an interesting one because I learned tongue work in a rather aggressive, assertive way. And then I started having people do tongue stretching or tongue work on me and realized that felt really threatening. But some people like their tongue pulled hard. But when I grab hold of a tongue, I tell you the same thing, Alexa. What I want to do is I want to take hold of your tongue and gently pull or gently engage in a lot of different perspectives so you feel like this is relevant, that you're tapping in that sense of, oh, I can feel that feeling. And that's what we're looking for. So you're going to have hold of your tongue. But let me just show you what I asked you to grab you grabbed a napkin or something. Napkins get a little grippy, they're dry, and you may have a little difficulty getting it off your tongue when we're done, just FYI.
Fine. I
I
like to,
use gauze or non-woven sponge like this, and you basically fold it above and let's pretend this is the tongue. I would have you fold it above and below the tongue, and then you're going to grab hold laterally, not right in the middle. Okay. Use two hands, right? What I want you to do is ever so gently. Well, first of all, you've got hold of your tongue. Now relax your mouth, relax your face. If your jaw wants to close a bit, allow it to close. And now you're going to ever so gently engage the tension on your tongue, which is a very different concept than pulling your tongue, right? But what I want you to do is gently engage to a level of tension that you feel is doing something. Now, remember, I asked you to remember what this feels like and what this feels like. Can you do something with your tongue so you begin to feel a connection to some of that upper range feeling? Move slowly. The studies that I that I quote in a lot of my work are studies that talk about how a sustained input can tap into centers of your brain that faster input um, doesn't. All right. So, what happens if you stay engaged? Can you begin to play back the tape, so to speak, and feel a connection to that upper range negative quality that you talked about? Can you feel that?
Mm-hmm.
Good. So, now again, you can't converse back and forth with me, but what I would be asking you is this familiar? Is this part of what you talked about? And you kind of nodded yes, right? Is there anything about this stretch right now that feels like it might be helpful?
Yes.
Yeah. Is there anything about this stretch that feels like it might be harmful?
No.
No. Is there anything about this stretch that you want to change? Meaning, if I was doing the work, I would say, Alexa, do you want me to pull harder or differently or play with different directions? And that's where I would invite you to literally put your hands over mine and help me help you by going to the place that only you know where it is, right? Is there anything about this stretch that feels like it might be helpful for that upper range issue?
I actually like it a little bit gentler.
Yeah, then there you go. So try backing off a bit. And if you're feeling like inside, whether it's your tongue or your brain, this feels like a good stretch, well, then hold the stretch. How long? Make it up, a minute or two. Hold it until your tongue gets tired. Hold it until your fingers get tired. Hold it until it's time to perform. Hold it until you feel like you've done enough. All right. This is my model. It's simple stretching, it's simple manual input. But instead of me calling the shots on what needs to be done, it's the two of us making these decisions together. Sure, I'm kind of guiding you, whether it's through the internet like this or whether it's hand over hand, but it's you truly doing all the heavy lifting of making all of these minute decisions on your own. Minute decisions meaning if you just twisted or lifted or did all sorts of different things with your tongue, does it touch into that part of you, whether it's this, or something in the larger aspect of a bullseye that you hadn't even thought about, that you start to feel a connection to? That's my model in a nutshell, right there.
Mm.
And you're doing movement. And
Yeah.
there's something about your past and present experience that says movement feels therapeutic. And I'll be blunt with you. I almost never do movement because that's not what I appreciate as a clinician. It's not my background. But I want to honor you as an individual that apparently movement feels interesting enough to you that you want to spend some time there. And that's what I love about shared decision making. You may take me to a style of intervention, a level of tension that I may never have chosen on my own because I'm not you and I can't know what feels good to you.
Yeah, I feel my tongue is less dancey when I move it.
Okay, good. All right, now let go or we're not going to be able to really have this conversation any longer.
I'll just eat the tissue.
Yeah, yeah, it's going to leave some stringy stuff on you there. Yeah.
Okay.
What's really fascinating is when I work with a vocal athlete of any sort, and I spend time engaging their tongue, which is another phrase for stretching the tongue, right? And you're basically working with their instrument. You know this stuff, right? And when when I give them back their tongue, it's so common where they don't quite know what to do with it because all of the sensory motor connections from peripheral to brain are predicated on certain feelings in the tongue and everything else. And when you hand that back to them, it's like all their breakpoints are different. All their learned awareness has changed. And it's actually kind of fascinating and a little bit humorous in a dark way, where you hand them back their tongue and they don't know quite what to do with it because it
Yeah.
doesn't quite work the way it used to. But as you work with them and watch them over the next 60 seconds, they go from not quite knowing how to make the fine motor adjustment to making them and then moving beyond where it feels like they have even better control of their tongue. Fun work.
It's really fun, and I can tell now that I feel my tongue is much more forwards in my mouth. I didn't notice it necessarily being back before,
Yeah.
but having done a gentle stretch and wiggled it around a bit, it feels actually a little bit more limber
Right.
and forward.
Right. Now, in the past, somebody might say, oh, that's because the muscles were tight and they were holding that tension. Or I might have said, oh, no, your fascia was restricted and wasn't allowing that tongue to protrude. Now I understand maybe nothing truly in the tongue, in the soft tissue of the tongue itself changed. Maybe it's simply up here where you now feel like, oh, I have different options available to me. It
Mm,
could be the muscle itself, but it also could be this big muscle up here, your brain saying, I now have further control and awareness, and therefore different options.
mm,
That's my model in a nutshell, right there.
Taking away from diagnostics, diagnosing
Yeah,
someone rather
yeah,
than, having, as you say, bringing awareness to the system.
right. And also not pathologizing them, not saying that there's something wrong, right? Which is what patients expect from, or clients expect from us, is to tell them what's wrong with them. And
Mm,
instead, it's like, okay, here's what's right with you. Let's make it righter, right? Um, Ultimately, they're going to want us to give us a diagnosis of some sort, whether we call it a diagnosis or a problem. So basically, we make things up. But what I do is I make up two things. You're going to walk into my room with some pre-existing thought on what's wrong with you based on what you believe, what someone else in the past has said, maybe your doctor said, maybe Dr. Google said, right? You're going to walk into my room with something, and I'm going to, as a clinician, I'm basically going to acknowledge that as a possibility. It could be your horrible posture, Alexa. I'm not saying you have it. It could be that horrible
probably.
posture. It could be that horrible posture that you said was the problem, or it could be a neurologic remnant from a past injury or something like that. Ultimately, we can never know which it is, but can we do something to get you past that problem, right?
Mm,
That's what I really care about.
mm. That's really interesting. And thank you, Walter. So I've
Sure.
got some things there that I hope other people can also take from that, as well as
Yeah.
me. So where can people find out more about you? Where can they get in touch?
Well, feel free to reach out on whatever social media platform you're viewing this video on as a message, and I'll be happy to get back to you. I love talking. I love talking to people. I love talking about this work. You can also find me from my website, which is waltfritz.com. You can find me hopefully late autumn, early winter via my new book that's coming out through Compton Publishing Limited, called Manual Therapy for Voice and Swallowing, a person-centered approach. Little plug in there. But feel free to ask questions because I would love to engage with you. And
Brilliant.
also, if you're in the UK, I come to London every March. We're going to be doing probably a second one in central England at around the same time frame that we've not confirmed yet. And if you're in other countries, I tend to show up in a lot of different places. So check out my website.
Brilliant. Thank you so
All
much.
right.
Really enjoyed
You're
it.
welcome.
Thank you.
You're welcome. Thanks for having me.